behavior. And I think, you know, from my perspective, and I've had a lot of conversations with law enforcement, and I think, you know, a lot of them share this view as well, is, you know, it's 10 or 15% of the people who commit 90% of the really violent crimes. Those are the folks that we need to be getting off the street.
Yeah, but right now we have 60% of the people.
But the 90% that are committing the 85% of nonviolent crimes, those are the ones that we really need to start thinking about alternative programs. Just locking people up for a few years and letting them out again so they can come back in, it's not working. And the crimes that they're doing are not the violent crimes that, you know, maybe are just really bad people. A lot of them are good folks.
Oh, okay. Now that's a good point. Bad people, good folks. Now, all right. Should criminology be absorbed within public health? Should criminology sit out on its own? Is that a, you know, like an old elephant that just needs to be kicked away?
I don't want to knock criminology as a field of study, because there's certainly some really good progressive criminologists out there. I think it's more the mentality of, if you commit a crime, it's because it's something defective about the person. And, you know, and in this whole punishment mentality, if we use criminology to say, hey, it's not just people, but it's social context. It's environmental upbringings. There are a lot of factors that influence why people get involved in crime. And you know, you and I were talking, for example, okay, so we had 150, 175 murder victims, right? It's young black males who are getting shot. I mean, it's statistically, as a scientist, nobody can really debate that.
It is what it is.
It is. Right. Having said that, most young black males under the age of 30 in the city of New Orleans are not getting shot each year. Okay, so is that pure luck? Or is there something else going on that we really don't understand to say, why is it that a lot of young African-American males who are growing up in the same neighborhoods, the same context, are finding a different way and either managing the violence around them or avoiding it? And why aren't we studying more of those young men who are getting an education and make it out and make something of their life, right? It's not, you know, they're growing up in those same environments.
Okay, we have about 1 more minute, and this last, maybe last. All right, but when public health is looking at mass incarceration and so forth, are they now, or will they begin looking at it from a historical perspective, looking at the role of African American males in this country over the past 400 years and carrying on through?
It's certainly an underlying backdrop that's there. I don't know, I think criminologists and sociologists probably have more of those discussions, but all of us are aware of it. And I think we can't separate the history of New Orleans from the present.
Slavery. Dr. David Seal, I think we have an interesting conversation going on now, and I would hope that the universities would make some decisions. I really, really do. I think it's serious about what's going on. I would think that our politicians would make some decisions, and let's start looking at evidence-based decisions for our politicians within the universities, and recognize the responsibility of both. I think we have to continually work hard and do everything we can, because there are people's lives are at stake right now. So we thank you for continuing to watch. And as we close on, this is Health Issues. Chris Sylvain, fight as hard as you can. Thank you.
Chris.